Hi, I'm Brian Shaw, a certified diabetes educator here at Sacramento Native American Health Center. If you've decided to watch this video, you're probably looking for direction on how to manage diabetes for yourself or someone else you know. Whether it's type 1, type 2, gestational diabetes, or pre-diabetes, I want to give you some pointers on what to do, either as a new diagnosis or simply if you need a refresher after living with it for years. The guidance offered during this next several minutes is very general and can apply to a number of people under most circumstances. You should know that the information that I present here is evidence-based. That means it's been tested to work in most situations and shown to work over a long period of time if you use these suggestions as they are presented. But like with all health information and guidance presented on the internet, you should check with your doctor first to make sure that this information applies to you and that you can use this information safely on your own to help you manage diabetes. So let's go inside and start exploring how to get the right guidance to manage diabetes. A diagnosis of diabetes or pre-diabetes isn't an easy thing to hear at all, and I understand it can be scary. And diabetes certainly has the potential to cause health complications. If you've lived with diabetes for many years and you need some direction or encouragement on what to do if you're feeling powerless, we'll explore how to get you feeling more in control with some tools to manage your health. Maybe you've seen family members or friends struggle with diabetes, or maybe you've even seen someone manage diabetes really well and you want to know what you can do too to live that way. With some basic guidance and some focus on a few areas on how we can live our lives, people with diabetes can live long, satisfying, healthy lives and feel confident about their self-management of this condition. So, let's get the right guidance. But first, let's start with a working definition of diabetes and build on that. Literally translated from the Latin root, diabetes mellitus means the passing through of a sweet substance. A fun fact is that the Romans noticed that people with this condition had sweet tasting urine. That's how it was diagnosed before laboratory testing. I personally would not have wanted to have that job. The sweet taste was sugar passing through the kidneys into the urine to get rid of the excess the body can't use for energy. But regardless of the type of diabetes, type 1, type 2, gestational, or pre-diabetes, this condition is defined as an excess of sugar, or more technically glucose, in your bloodstream, higher than what is the established range for somebody who does not have diabetes. More on that in a minute. Your body needs glucose at all times to function. It's your body's fuel. But having an excess over several years can lead to complications that can affect several organ systems, like kidney and vision problems, amputations, heart attacks, and a laundry list of others. This excess glucose in the bloodstream comes from the body's inability to produce enough of an essential hormone called insulin from an organ called the pancreas, which is right around the stomach area. And in many cases, if insulin is being produced at all from the pancreas, it's also not doing its job effectively to regulate blood sugar or blood glucose. Both insulin and glucose are required for survival at all times, but just in the right amounts. The suggestions in this video will help you possibly find a balance between those two. So part of the approach to effectively managing diabetes is to reduce the amount of added sugars in our diets. Severely limiting or getting rid of things like soda, juice, cookies, chips, candy, junk food, and fast food is part of it, but just the start. So start there. While a majority of the questions I get as a certified diabetes educator go something like, what do I eat? And certainly we will review this. There's so much more to diabetes than just our diet. Don't get me wrong. What we eat and how we eat are a cornerstone of living well with diabetes, but we also need to keep in sight several other areas of our lives. The next part of this video will be broken up into 5 sections. Get the right care from your care team, get to and maintain a healthy weight, get the right nutrients to eat, get the right amount of exercise, and get the right amount of sleep and manage your stress. First is get the right care from your care team. Your primary care provider, whether a doctor, nurse practitioner, or physician assistant, they're all key players in your care. Your care team also includes nurses, medical assistants, specialists, registered dietitians, or certified diabetes educators. These are also really important people to discuss your health with. Be sure to see your primary care provider at least between 3 and 4 times per year, and make sure to have the following labs done. At least a hemoglobin A1C, which is your average of your last 3 months of blood sugar. This is expressed in a number like 6, 7, 8, or higher. For reference, absence of diabetes is about an A1C of 5, and diabetes is diagnosed at an A1C of 6.5 or higher. Be sure to know what your A1C goal is. Also, be sure to have the following exams performed, at least according to the timeline that your doctor suggests: a foot exam, a dental exam, an optometry exam, a blood pressure check, any vaccines or immunizations you're due for, and any other screenings that are recommended by your care team. Also, make sure to bring up any kind of anxiety or depression that you feel in your mental health so that your primary care provider can provide you with the best resources to treat that. Regarding your own management of diabetes, ask if you should check your blood glucose at home, either using a glucometer or something called a continuous glucose monitor. Make sure to understand your blood glucose goals. In general, these will be between 80 and 120 milligrams per deciliter first thing in the morning, called fasting, after not having eaten for 8 or 10 hours. This is generally the lowest reading of the day. As well, the highest reading of the day is going to come 2 hours after your largest meal, and that number in general should be somewhere under 180. Your blood glucose goals might be different than this, so make sure to ask. And if you need help figuring out how to use one of these blood sugar monitoring devices, ask your care team. They'd be glad to help you. Most people find it helpful to keep a blood glucose log to share with their care team. This will help determine your treatment plan. Also, since your treatment plan may involve medicines that need to be taken at a certain time of day, with food or without food, make sure to ask questions of your primary care provider and your pharmacist about how medicines are taken, as well as what your blood sugar goals are.
I do have some questions about my blood sugar goals and the medicines I take.
Excellent. So we're going to be able to go over all of that. I love that you're asking those questions.
Second, get to and maintain a healthy weight. For most people with diabetes, reaching and maintaining a healthy weight is critical for your ongoing health. This might involve losing between 5 and 10% of your current body weight. For example, if your current weight is 200 pounds, losing between 10 and 20 pounds can make a substantial improvement not only for diabetes, but also in your overall health. Maintaining a healthy weight is vital to help our bodies make enough insulin in type 2 diabetes and have that insulin work the most effectively to regulate blood glucose in all other forms of diabetes, whether you inject it or not. Weight loss can be tracked by stepping on a scale once per week at the same time of day each time. Remember to have an empty stomach, wearing minimal clothing, empty your bladder first, and I suggest first thing in the morning. And the suggested safe rate of weight loss is between 1/2 pound a week to 2 pounds a week, depending on how many calories you intake each day. And remember, there's no such thing as an ideal weight. The healthiest weight for you is going to be a range of weight values depending on your height, sex, and age. Check with your doctor or healthcare provider about what your healthiest weight range goal is. And you can get to a healthy weight partly by having a healthy diet. So third is get the right nutrients to eat. As I mentioned earlier, the biggest question I get as a certified diabetes educator from patients managing diabetes is, what do I eat? Thankfully, my friend and colleague, Crystal Orozco, is going to help us understand how to get the right nutrients to eat. Crystal is a registered dietitian and also a certified diabetes educator with her company, Vita Nutrition. Thanks for joining us, Crystal.
Thank you, Brian. Like Brian said, my name is Crystal Orozco, registered dietitian nutritionist and certified diabetes educator. Today, I will be talking about the balanced My Plate method, which is a great way of planning your meals for breakfast, lunch, and dinner. And so today, let's start with this plate here. Let's talk about portions. So maintaining your blood sugars has to do a lot with portion control. When you eat a big meal at one time, that will spike up your blood sugar more than when you eat smaller, more frequent meals throughout the day. So I do recommend using a 9-inch plate for breakfast, lunch, and dinner. This is a 9-inch plate. And this helps maintain your portions and therefore more stable blood sugars at target goals. So we recommend half the plate to be non-starchy vegetables. Non-starchy vegetables have minimal effect on your blood sugar. Therefore, we want the majority of your meals to have those vegetables. This could be a stir fry. This could be steamed vegetables, a salad, a soup with lots of vegetables. It's all vegetables except for 3 that are the starchy vegetables that we'll go over in 1 second. Then we have our protein here. Protein also has minimal effect on your blood sugars. Protein is found in meats, eggs, nuts, seeds, and tofu. Then we have the last quarter of our plate here, which is our whole grains or carbohydrates. And the recommendation is that 50% of our total grains for the day come from whole grains or high fiber carbohydrates, also known as complex carbohydrates. And those are found in oatmeal, couscous, beans, legumes, so all the bean family, garbanzos, black beans, kidney beans, brown rice. And then we have our 3 starchy vegetables that are known as potatoes, peas, and corn. There you have it. And now let's look at what that looks like in real time. Here, this is a beautiful and delicious meal following that balanced My Plate method. Half of our plate here is the non-starchy vegetables. This is a vegetable saute with onion, red bell pepper, broccoli, yellow squash, zucchini, and carrots. And again, half of our plate is non-starchy vegetables. Every color has a different nutrient, so I'm really encouraging using all vegetables. Then here we have 3 to 5 ounces, so a quarter of our plate is our protein, our lean protein. And here we have grilled chicken, 3 to 5 ounces. You can also do shrimp, you could do salmon, you could do some tofu. Then moving on to our carbohydrates. So here I did 1 cup or your fist, that's the recommendation. And I did brown rice mixed with corn. And again, you can have the 3 starchy vegetables. They have fiber, they have nutrients, but it has to be counted in the carbohydrate section rather than all the other vegetables, the other half the plate. And so I mixed here corn with brown rice, and that's about 1 cup of our plate. And there we go, beautiful and delicious. Enjoy. And you can follow me for more tips and tricks on Instagram at Viva Nutrition Consulting. Take care.
Thanks again, Crystal, for your guidance on how to help us eat healthy. Crystal showed us some examples of how to design a healthy plate with the right balance of nutrients, and then she showed us what the finished product would look like once you put it all together. Here are some other examples of some healthy meals that follow the same pattern. Next is getting the right amount of exercise. And for most people, that's going to mean between 5,000 and 10,000 steps per day, or roughly equivalent to about 30 to 45 minutes of intentional physical activity a day. If you get this kind of physical activity most days of the week, that's going to help the glucose in your bloodstream be used a little bit more efficiently. If you want to track your steps, you can buy an inexpensive pedometer that will do that, or some phones have a built-in pedometer setting that will also track your steps per day. It's really important to make sure that you do physical activity or exercise that you like. There's no sense in doing something that you don't like, that you can't do multiple days of the week, but make sure that you do a variety of exercise that focuses on different parts of your body. Also, you can just start simple in your own neighborhood. Take a look around, find a place, and go walking. Or finding your local bike path and walking. Or find your local park and go walking. or walking on a treadmill. And while walking is the exercise most people can identify that they can start and keep with, there are so many other forms of physical activity and exercise that are enjoyable and helpful. For example, hiking, or running, or skiing, or swimming, or dancing. Or if you like the outdoors, go hiking with family. Also make sure to include some weight-bearing exercises, that is moving a weight across a distance to help strengthen and condition your muscles. You can start at home by using your muscles in a low-impact manner by using something like a resistance band. Or if you prefer, you can use something like water bottles as weights. If you have access to a gym or equipment, you could do things like rowing. Or try using a machine. Or stationary bike riding. Or an elliptical. Be sure to include some stretching to help warm up your muscles and avoid injury.
So let's take the left arm up, and we'll go over towards the back of the chair. You can always take the arm out of it, lower it onto the head if you'd like.
Last, but certainly not least, get the right amount of sleep and manage your stress. As it helps with planning daily meals, most people do pretty well with a set schedule. Start by turning off electronic devices about a half an hour before you plan to go to sleep. Our bodies need time to rest and recover without food and have a chance to recharge our batteries. For most people, this means getting between 7 and 9 hours of quality, restful sleep at night. Have a glass of water next to your bed, but leave all other food and drinks in the kitchen. Have the same bedtime routine each night and go to bed at the same time each night. And wake up at the same time each morning. You can help manage your stress by putting your thoughts and efforts into activities that are rewarding and relaxing, like reading, doing something creative, playing a musical instrument, gardening, planning meals ahead of time, listening to music, meditating or deep breathing exercises, exercising, or study a subject that interests you, or journaling your thoughts and feelings, or spend time with friends and family, or spend time with a pet, or organizing and cleaning your home. Do as many of these things as possible to help you refocus your attention off of stress and channel it into something more constructive and creative. And one final note on support. No one is expected to do all of these recommendations at once, and certainly it is not possible for anyone to complete all of them at the very beginning of their diabetes care journey. Work on building your confidence in each area that we have covered, and start with 1 or 2 small changes that you know you can make. Build on those successes into the other areas that we have covered. If you need help, ask from your care team and your primary care provider. Treat yourself with kindness and patience, and remember, diabetes is a condition that can be managed with some changes to your life. You can live a long, happy, healthy life if you get the right guidance and support for your efforts. Take care of yourself. Until next time.